House, this is the kind of case you love. Contradictions piling up left and right.
Keep going. You're being an idiot. You can't hide from misery.
This isn't your business.
My skull was cracked open trying to save her.
We have a patient.
I'm leaving the hospital. I just need a change of scenery.
Buy a plant.
And fetuses have been transplanted before, whole uteruses too.
I was so shocked when I found out about this that I needed to take a few seconds to make sure it was real. Very excited to be reacting to House MD Season 5 Episode 1 Dying Changes Everything. On this channel we are reacting to all 177 House videos. This is episode 96. Let's see if I can get the diagnosis before House does as a doctor working in London.
9 men. No one thought it might be a good idea to put a suit on one of the gals from the steno pool to make it look like you give a damn. 6 out of 10 victims never even report harassment.
Somebody help me! Please help me! I can't get him off! Help me!
9 men staring at a lady ripping her clothes off. Good start to a harassment meeting. They probably would have done better if they just installed a pole in the middle of the table and called in Crystal with a K to open the meeting with an upside down double leg grab. I've seen a patient with this exact symptom though, delusional parasitosis. He came in saying that he was being bitten by these insects at home, but every time he mentioned that there was one of them in the room, his housemates couldn't see it. While sat with me, he pointed at his skin saying there was one, but I couldn't see it either. And then he said there were mosquitoes in London in the middle of winter. That's when I definitely knew I didn't just need an eye test. Turns out he was using heroin though, which our very functional looking office worker probably isn't, but you never know. Other things that could cause it include things that also cause delirium, like a bad urine infection leading to sepsis, pneumonia, herpes brain infections, abnormal electrolytes like low sodium, or a whole host of other things. Definitely need more clues.
Wilson's back. You gonna say?
Gone 2 months.
When was the last time you talked to him?
When did his girlfriend die? He wanted time alone.
Just got a call from Patty Mishner from Women's Majority, the women's rights.
We know who she is.
Her assistant flipped out, ripped off her clothes in front of a room full of businessmen. Anemia, bradycardia, and abdominal pain aren't psychiatric symptoms.
I'll give it to Siegel. House has more important things to do.
I agree that those symptoms aren't primarily psychiatric, but there's one patient I saw that really makes me want to disagree. Trigger warning, just a heads up, this case involves self-harm. She was a 19-year-old girl who kept coming to A&E time and time again because her method of self-injury was to try and bury razor blades as deep into her tummy as possible. Every time she came in, she would need them surgically removed, and one time she got it so deep that she actually cut her own bowel. And you can imagine how motivated she was because there was a lot of tissue to get through until reaching the bowel. That meant she had chronic abdominal pain, could get anemia from the bleeding and self-neglect. Then bradycardia or a slow heart rate can happen from all the painkiller pills that she was having thereafter. It's pretty clear this isn't our patient though, so what's going on with her? First, it'll be really helpful to know what type of anemia she has as we classify that based on the size of the blood cells. You see, our stem cells are constantly regenerating our blood cells, and if they get released too early or too late, that can affect their size. If the cells are too big, then it's likely related to low thyroid hormone, alcohol use, B12 or folate deficiency. If they're too small, it could be iron deficiency or a genetic condition called thalassemia. If they're a normal size, that could be related to kidney disease or a different chronic disease like diabetes or rheumatoid arthritis. There are medications that suppress the bone marrow that can also cause anemia as well, but they would also affect other cells that are produced by the bone marrow like white blood cells and platelets as well. Interesting to see that Cuddy's actually stopping House from taking this case, but he doesn't seem overly keen to have a heart-to-heart with Wilson, so something tells me that Sherlock Lorry won't be thrown off so easily. Question for you smart people, what percentage of the population actually has anemia of any cause? Answers down below and I'll give it to you at the end of the video.
Sorry, can't help you. You need a specialist to remove those kind of warts. Talk screen's cleaner than the windows she won't do.
The job keeps her constantly on the road, probably living off of airline peanuts.
Pump her full of B12. See how a strong career woman's been made sick by her strong career.
I was just tired and dehydrated.
Yeah, whenever I lose some shut-eye, I pound my legs clawing at imaginary ant colonies. Get back in bed.
I just had a bowel movement.
That's not about movement.
Yesterday's sluts are today's empowered women. Today's sluts are celebrities.
I'm leaving. I'm writing Cuddy my resignation right now.
She's bleeding from nowhere.
Yeah, there is no way this show would have aired in 2023. It was towing the line even for 2010. Also, Wilson's leaving. He's the house's only friend. Surely that can't happen. The patient said something earlier that she's fine. We have to be very careful of patients who say that, as they're most at risk of getting very unwell. You see, patients have a massive range of anxiety levels, from the person who will come in for a runny nose or a slight muscle ache to the stoic who will be pooping enough blood to sustain a vampire colony and still not get checked out. Our patient seems like the latter, and so we have to be especially careful to look after that group because they may be inclined not to do so themselves. Either way, we have some new clues: bleeding from the back passage with no abnormality found, and the team mentioned she had memory loss as well. Previously, they did say that she had anemia, and the bleeding could be an indication of low platelets as well, which are like these little balls of superglue in our blood that help plug holes when we damage our blood vessels. Pretty cool when you think about it. Without these sticky sealers, it's possible that even with a slight blood vessel abnormality in the gut called angiodysplasia, it can bleed like crazy, and then the vein or artery retracts back into the wall like Homer Simpson into a bush. Then when an unsuspecting camera comes along, all they see is the bush and not the yellow man standing behind it. If there's anemia and low platelets, then that could be a bone marrow problem, indicating a blood cancer, radiation, toxic exposure, or even HIV. So let's get more clues.
One of the routine pre-procedure tests was positive.
I'm pregnant.
You want to call the father, let him know?
As soon as you do some DNA testing, let me know.
The ultrasound shows no trace of a baby at all.
B12 deficit rectified, but her heart's slowing even more.
And a bleed should speed her heart rate.
House, this is the kind of case you love. Contradictions piling up left and right.
Keep going. You're being an idiot. You can't hide from misery.
This isn't your business.
My skull was cracked open trying to save her.
We have a patient.
I'm leaving the hospital. I just need a change of scenery.
Buy a plant. The patient tested positive for pregnancy because the patient is pregnant. In rare cases, it plummets through the plumbing entirely. It's using her intestines as a blood supply. Yank the fetus.
What if she wants to keep the baby?
Fetuses have been transplanted before, whole uteruses too.
I was so shocked when I found out about this that I needed to take a few seconds to make sure it was real. There have been actual cases of pregnancies which started outside the womb and were transferred back in. The first is from 1915 by Clifton Edgar. A 27-year-old woman came to his clinic having struggled to get pregnant for the last 5 years. She had a growth inside her womb called a fibroid, and so they began operating on it, but were very surprised when they found a pregnancy in her fallopian tubes as well. The surgeon knew her backstory and difficult with fertility success, and so wanted to save the baby, and did so by cutting around the olive-sized sac and sticking it to the womb. A baby boy was born around 7.5 months later. Of course, this is a freak case where the ectopic was caught early with a lot of good fortune and the baby implanted successfully. In the modern day, all ectopic pregnancies are terminated because they can kill the mother with massive bleeds when they grow in the wrong place. In case that isn't crazy enough, there was a case from Ethiopia that challenges everything we thought we know. At 18 weeks, a 26-year-old woman realized she was pregnant and even had an ultrasound to confirm that it was in the uterus, and it was. Then, at 37 weeks into the pregnancy, she had abdominal pain and was taken to hospital, where an ultrasound showed that the fetus was nowhere near being in the womb and her head was actually pressing up against the spleen at the top. She was taken for emergency surgery and the baby was born safely at 2 kg, and they realized the placenta was still getting blood supply from the uterus, but from the outside. These abdominal pregnancies are really rare, only making up 1% of total ectopics, and they almost never survive. Considering that is possible though, who knows? This may change in the future. It seems like 13 is trying to change it already, so let's see how she gets on.
Saving it is a fantasy. People die. You, Amber, everyone. Don't act like you just figured that out.
Remove the fetus. Absolutely. Oh, where do I sign?
Separating placenta from the wall of the large intestine.
BP's dropping, 90 systolic.
Bleeding like hell.
Ambeth calcium chloride fast.
Still dropping.
Shut up!
She's stabilizing.
I hate Visitor's Day. Removing the fetus.
You want to keep him, he needs to know he's not alone. Just tell him you feel like crap.
She's got a neurological problem.
So she keeps on blinking.
Her heart's not recovering either.
So the pregnancy was a coincidence.
We need some help in here!
I'm going home until you agree to stay at this hospital. Patient's in cardiac arrest. Your friendship matters more to me than this patient.
Where is he?
Whoa, 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 House loves blackmailing people, like threatening Cuddy with food in the morgue during an inspection so he can get a TV, or when he found out a hospital surgeon was cheating and used that to get him to do a liver transplant, then told his wife anyway. All of those have something in common though, they're either innocent or to help a patient. This is the first time that House's actions could actively harm this patient. You could say that if Wilson stays, then more than one patient will benefit, but in reality, it doesn't work like that. People who leave get replaced, and even though quality is different, the service tends to be quite similar. That's also another thing that doctors or healthcare professionals in general can struggle with. This idea that if we don't provide the care, then someone else would be in our place doing so as well. In the context of shortages, that may not always be true, but you can never really know. Also, patients don't think like that. All they know is that you're the person who fixed their child, found their heart attack or cancer, and saved their life, which is pretty satisfying. Now, it seems like this case is back in full swing, as even without the pregnancy, our patient is blinking too much. It's called blepharospasm, and scientists aren't quite sure what causes it, but it is associated with some systemic diseases like Wilson's disease and dystonia. Wilson's could cause other neurological and heart symptoms as well, so that has to be my first diagnostic guess.
MS explains everything that's wrong with her right now.
Start on interferon for MS.
You're willing to risk your career, but you're not willing to say you're sorry.
I told him I'm sorry. He didn't believe it. I don't believe it.
You're doing the same thing he is. You're running away. He's not killing anyone in the process.
Not everybody's created equal. Does Dr. House think I have MS?
Yes. You're running a slight fever. It means we were wrong about the MS.
I am permanently setting every TV in this building to the Pottery channel unless you both sit down.
Stop the tape. On the anastomosis, that little bump. Could be a ganglioma, which is why Chase shouldn't have ignored it.
We have to open her up again, get a piece of it.
Which hospital administrator would go through this length to sort an issue between colleagues? This is where we find out that Princeton Plainsboro is in Canada. This episode is getting very interesting as the team need to learn how to diagnose without House around. Foreman seems to have taken charge, and 13 is in an internal battle because she just found out she has Huntington's. It's all falling apart. There is one positive though, a new clue. This ganglioma lump in the bowel. There was a bit of a boo-boo from the graphics team here, as Cudner said it was on the anastomosis, which is when you join two pieces of bowel together, which isn't shown quite right on the video. Of course, they didn't expect a doctor to come and start looking at it with a tiny monocle, so we'll let that slide. What could this ganglioma be? Well, it's a type of abnormal nerve growth which could be cancerous. One lesion on its own tends to not have any associations, but multiple can be linked to tumor syndromes like neurofibromatosis type 1, Cowden's disease, or multiple endocrine neoplasia 2B. This is House, so a single lesion could still have the association, and a really interesting one would be MEN2B. Why that specifically? Well, not only can it cause tumors in many different organs like the thyroid, parathyroid, adrenal glands and others, those tumors can secrete hormones that massively knock your body out of sync. Like it can be associated with a type of bowel tumor called a paraganglioma, which is related to adrenal tumors called pheochromocytomas that crank out catecholamines similar to adrenaline faster than you can say Charlie Sheen court case. Checking the urine for their breakdown products and scanning other areas will help, and then treatment would be surgery to slice out that culprit tumor or tumors. That will be my second diagnostic guess.
I told him he's an idiot.
I'm sorry you lost Amber. I cannot imagine what it is you're going through, but it will not get better by you walking away from everyone that cares about you.
Same time next week.
We need a piece of the ganglioma.
She can't survive a second round of general anesthesia, let alone a third.
We insert a lighted scope through the rectum, move the intestine until we find the ganglioma, then push it to the surface. Where we see the light, we cut.
Can I talk to Dr. House? My former boss didn't insist on me coming here because of you or...
Your former boss?
I've been replaced.
How can you let her treat you like a footstool?
The world needs flunkies.
What kind of feminist? We can have anything.
No, we can't. We don't get it just because we want it. I would rather spend my life close to the birds than waste it wishing I had wings.
Push the wall of the intestine toward the skin.
There, I see it.
It's not a ganglioma. Problem wasn't the surgery.
Abnormally deposited proteins. It's amyloidosis.
13 is massively seeing herself in this patient right now. House isn't around, she's losing her authority to make a decision, and the patient's trying to make her believe that she could never be a genius. But Are geniuses really born, or are they made? There is a popular notion in society that geniuses are naturally well endowed due to the genetic makeup of their parents. We know that intelligence is definitely heritable, but we also know that high intelligence itself isn't enough to create genius. Take the example of Rick Rosner, a man with an IQ close to 200, as evidenced by over 30 tests. He started his life as a stripper, bouncer, and nude model. When he realized his intelligence, he went on to Who Wants to Be a Millionaire and then got a question wrong at the $16,000 level. He then spent a significant amount of time and resources suing the show, stating it was a question error that ended up losing the case. Not exactly an Einstein level legacy, even though his IQ was around 25% higher than Einstein's. So what other traits is it that translate natural potential to genius? Well, personality and wisdom. We know that the highest earning personalities tend to be judging rather than perceiving, which means that if you're given a task with a deadline of 30 days, you're more likely to complete it on day 1 to 7 rather than day 28 or 29. Extroverted people also tend to attract a higher salary, which we know are those who are energized by social interaction rather than drained by it. Another really good example of independence of utility from intelligence is the comic book guy in The Simpsons. IQ of 160, but very limited use to anyone, and that isn't just the exception either. I've met many intelligent people in my time who suffer greatly with mental health difficulties because of the constant overthinking and the feeling that they can't really relate to ordinary working class people. That's where wisdom comes in. People have tried to measure that, but failed almost universally. You can say that wisdom is an understanding your personality type and filling in the gaps to know what hat to wear for each situation to get the best outcome. You don't need intelligence for that either, but when you pair them together, you get a killer combination like Tesla, Einstein, or Edison. In society, we love the stereotype of the born genius like House, but the reality is that there's a lot more that went into its production than a random assortment of genes. She'll have no intelligence left soon though if we don't figure out the cause of this amyloidosis. So what even is that though? It's a condition that leads to misfolded proteins called amyloids in different parts of the body. These deposits can disrupt the tightly defined conditions for our cells to function and lead to damage of our organs. And there are three main types. Hereditary, where mutations of specific genes lead to the abnormal protein production. Primary amyloidosis, where cells can start overproducing these proteins directly, like in multiple myeloma, for example. Or the third type, which is secondary, where they become a byproduct of other conditions with chronic inflammation, like infections or autoimmune conditions. Examples are like inflammatory bowel disease or chronic infections. The most spicy type is the secondary type, which must be what's happening to our patient. That doesn't exactly narrow it down much though, as we've now got choices from a whole host of conditions, but which can cause seeing insects, a cardiac arrest, and eye twitching in a feminist activist. I have a theory. Our feminist advocate has been fighting for women her whole life, and it's her ovaries trying to kill her. She could have a small ovarian cancer, which is too small to see on a scan, but causing havoc by releasing abnormal proteins to mess with all her organ systems. Cases like this would be very rare, but have been reported. So it fits the rare factor, fits the irony factor, and the symptoms. That's going to be my third diagnostic guess, so we are locked in.
The only way to treat amyloidosis is to treat whatever's causing it.
Lymphoma.
If we don't find the cause of the amyloidosis, we never get her off that wire, she never walks out of this hospital.
She really is dying, isn't she? Enlarged nuclei, it could be lymphoma.
We'll start her on chemo.
Lymphoma was your idea? You've given me 18 different treatments. This is the first one that made me feel better. You're not like me. Maybe you have wings.
I have Huntington's Chorea. I won't be able to fly. I won't be able to breathe. I want something to be different because of me.
I am. I'm applying for a job at a foundation, running the finance division.
You look 37.
I am 37.
You looked 27 last week. Did she have bruising? It's not lymphoma.
Just when 13 was starting to feel like the world isn't such a terrible place and her life may have some meaning, Hal swoops in and takes us all from the promised land to peasant in 2.4 seconds. We do have some more clues though. Rapidly aging skin and easy bruising could be an indication of a few things, but considering the systemic nature of this and the abnormal amyloid proteins, then scleroderma would be a good idea. The reason why she's feeling better is because chemotherapy also kills your rapidly dividing immune cells as well as cancer cells, so chemotherapy would work, but it's like trying to clean up your bedroom with TNT. Technically, it would get rid of the mess, but it may cause some collateral damage. If I had a diagnostic guess left, I'd use it on scleroderma, but at this point, I'm just firing blanks.
Those aren't bruises. They're mycobacterial lesions. She has diffuse lepromatous leprosy. Must have caught it on one of her overseas estrogen tours. It doesn't disfigure, it makes her skin look younger. Blast her with antibiotics and prednisone. She'll be fine.
Test confirmed Dr. House's diagnosis.
I'm going back on the road with Patty.
You can change.
I'm not sure I want her to change.
I like you better now that you're dying.
I was wrong.
Took a shot.
She almost died.
Almost dying changes nothing. Dying changes everything. I'm sorry. She's dead because of me.
But it wasn't your fault. Amber was never the reason I was leaving. You spread misery because you can't feel anything else. The games, the binges, you should have been alone on the bus. We're not friends anymore, House.
Oh, this seems like Wilson has found House's Achilles heel and plunged a verbal dagger in it deep enough to find his very well concealed heart. It seems to be the cost of House's genius. Yes, he can come in and diagnose diffuse lepromatous leprosy, which I didn't even remotely think of, but when all is said and done, it'll be an evening of whiskey and Kleenex for him and not for his nose. That's what makes him so interesting though. Where'd the fun be if he was a whole well-adjusted guy? Humans love conflict. It creates drama, uncertainty, tension and fear, all things that keep us more on edge than fighting for a plain armrest. What is diffuse lepromatous leprosy though, and how can it make you look younger? You see, there are multiple different types of leprosy based on how the body's immune system reacts to the Mycobacterium leprae pathogen. In this diffuse type, the body produces a type of vasculitis with some swelling inside the tissue. That basically gives you the effect of fillers for your whole body. This only lasts for a short while though, until the necrosis stage where bits of you start dying like the bridge of the nose. Some antibiotics will fix her up, but no quick fix is there for House. Really good episode. 7.5 out of 10 entertainment, let's say 7 out of 10 accuracy, because the lesions seem to happen a long while after exposure, but you'd expect them to come on faster. It's an 8 out of 10 diagnosis. 30% of people actually have anemia. This episode only makes full sense when you watch the 2-part season 4 finale, where the series reaches a huge climax here.